Good evening. I bring greetings from the Association of Healthcare Providers India, and I'm going to quote extensively from a white paper that HPI had prepared, a vision for a healthy India, which I think is appropriate for today's talk. All of us know that the Indian economy has been growing at a staggering pace in the last 5 years. Many typical consequences of a fast developing economy can be seen. There's a drop in fertility, there's increased life expectancy, and increased per capita income. However, unfortunately, health outcomes remain conspicuously poor and unevenly distributed, in large part due to an underdeveloped healthcare industry. And this, in turn, has led to multiple problems. There is a massive loss of economic output from low productivity due to both non-communicable and communicable diseases. The impact of this in terms of GDP is close to, in dollars, 39 billion US dollars due to ill health. And the impact of this is about 6.1 trillion dollars on the GDP of the nation. Another problem is a lopsided healthcare provider industry with underinvestment in preventive medicine and primary care, and this has led to expensive hospital-led healthcare system. Also, there is a very highly uneven distribution of health outcomes across geography and income bands, exacerbated because of the situation in the country. An underdeveloped payer market resulting in misaligned incentives for the healthcare industry. For this, to make in simple language, I think that the reimbursements from the governments and from other payers are not done on a scientific basis. Very importantly, also, another problem is that there is an acute skills shortage in key healthcare professions. And I must say that in the last 1 to 2 years, the Union government has taken massive reforms, and this is in the process of being corrected. So we believe that this creates both an unanswerable case for public investment and reform, and there is a compelling market opportunity for this private sector participation with the right focus and imagination. The traditional healthcare solution with more expanded infrastructure and provision, which is more in the Western world, I think is unsuitable for India. Such a system, for one, would be too expensive, it would take too long to develop, and it will not be implementable, it will not be practical for our country. The new government, not the new government, the India government, I think has put greater focus on healthcare. In the beginning, the National Health Policy was announced in the year 2017, and later in the government launched the world's the largest insurance scheme under the name of Ayushman Bharat. This aimed to get universal healthcare coverage to all our citizens. The two components of this, as most of us know, one is the AB scheme. There is a 1.5 lakh health and wellness centers. And the second component is the Prime Minister's Jan Ayog Yojana, the PMJ, which aims to provide insurance coverage up to 5 lakhs per family under designated and to the designated underprivileged sections of society. The schemes are by all standards very ambitious and path-breaking. And once this is implemented effectively, it will usher in a new India, a healthy India. We, the Association of Healthcare Providers, we represent the vast majority of healthcare providers through 21 state chapters, and we are fully committed to support the government's initiatives in line with its motto, the motto of HPI, educating and advocating for well-being of the common man. So with this introduction, I'll very briefly go through what our recommendations are. So basically, we have put all these points under 6 important heads. These are the key design principles for strengthening of Indian healthcare. Meeting people's health needs through comprehensive, promotive, protective, preventive, curative, rehabilitative, and palliative care throughout the course of life, strategically prioritizing key healthcare services aimed at individuals and families through primary care and the population through public health functions are the central elements of integrated health services. This is what we recommend. If healthcare services are not available when and where needed, any effort towards universal healthcare, which we ultimately aim for, will be incomplete. So we at HBI believe that India needs something different. We are a different country. We are many countries in one country. The need to explore and adopt best international practices and the possibilities of relevant and cost-effective digital innovation could serve as an inspiration to design something which is uniquely suited to the health needs of our population, the Indian population. So to design the sustainable system, we believe that India should focus on the following points. The first point that we should focus on health, not healthcare. I think this is something which is very important. The health of the population should be maintained through preventive care. And let me repeat this since this is very crucial. The health of the population should be maintained through preventive care instead of episodic and acute care. Improved health levels and innovative ways for people to stay healthy should be the mainstream. I think this is the mainstay of what we recommend. The second principle, the second design is that health is a national agenda and integrated in all policies. I think health is something which goes through all different areas. Given their universal and multi-sectoral nature, each SDG has a relationship. The SDG is the Sustainable Development Goals. Each of these has a relationship to health and well-being. And so there is an urgent need to evaluate health to a higher level of priority and importance in many national contexts. The third point is that the most vulnerable should be prioritized. All dimensions of marginality, that's availability, accessibility, and affordability, should be taken into consideration while working on Ayushman Bharat 2. The fourth principle is that citizens and communities be engaged in the whole of society approach. We believe that engaging communities in decision making, planning, and implementing programs and policies that are about their own health and well being can lead to sustainable change. So, in a nutshell, point four is that we need to involve all the stakeholders, especially the communities in decision making. The fifth point is that we need to improve healthcare infrastructure to improve access and availability. So, again, to achieve health for all, the first and foremost step has to ensure that we have the necessary infrastructure in terms of healthcare establishments. So, as I said earlier, we need staffing, we need infrastructure. And the sixth and very important point, especially in this in this pandemic time, which has taught us the digital health and innovation to widen access. Digital technology can help healthcare providers overcome their current accessibility involvement through this area. And for an example, telemedicine, we are able to reach the most distant areas of our country. Services will be delivered more widely and reach remote rural areas, which at the moment is not happening. I must say that in the last year, 6 months, things have improved, but there is still a long way to go. Systematically addressing the broader determinants of health, this will include social, economic, and environmental factors, as well as individual characteristics and behavior, through evidence-informed policies and actions across all sectors. We envision a healthcare design that empowers individuals, empowers families, empowers communities to optimize their health as advocates for policy that promote and protect health and well-being, and as co-developers of health and social services, and as self-carers and caregivers. So very briefly, just a little bit on each. The point number one, health, not healthcare. The proposed interventions are there should be a national primary care network, public and primary care clinics and GPs. We recommend national health UID of every individual and a mandatory health screening of every citizen is also recommended in our recommendations. Under point 2, there is health as a national agenda and integrated in all policies. We should explore ways to make health a national priority and ensure cooperation between different sectors. We should ensure that health is a GDP driver, acknowledge and recognize the economic case for investing in health in order, especially to avoid the ongoing challenge of premature mortality and to make significant progress towards achieving sound health for all citizens. We should also ensure that all citizens have access to good health and well-being, since economic case is insufficient alone if real progress is to be made towards achieving the health-related SDGs. And finally, under this point number 2, we have to ensure that there is convergence of programs, ministries, and cross-ministries policy. So here, the interventions that we propose, that we recommend, are that implementing multi-sectoral action plan for the prevention and control of both communicable and non-communicable diseases. Then number 3, the most vulnerable are prioritized, and here the proposed interventions are, I'll just mention a few points on this, that the financial and health security are the most vulnerable, and here I think it is important that we need to, in our quest for universal health coverage, we need to also expand Ayushman Bharat, the Prime Minister's scheme. And for this, it is important that the government also invests a little more in secondary and tertiary care. And it is also important, I think very crucial, especially since there is a private partnership in this and many private hospitals are being utilized, that there should be a reconsideration in rates of medical procedures under these schemes. And the government needs to undertake costing exercises. This is to ensure that the financial viability of healthcare institutions, so that they will be able to provide quality and affordable care to all our citizens. So proposed interventions for this is, as we mentioned, that there should be a mandatory health coverage for all. That every individual should have some sort of a health coverage through cross-subsidized model where the rich can pay for the poor. And this can be linked to the Aadhaar number, etc., to ensure that the implementation is effective. Now, going to point number 4, where citizens and communities are engaged in the whole of society approach. Here, the interventions that we recommend are that there should be a national public-private stakeholders forum for health, working on an agenda. I think so. Again, we're talking about involvement of stakeholders and jointly develop an inclusive, comprehensive policy and programs to improve the health of our citizens. The second intervention that we recommend is the SWAST application for citizens, where we develop and promote citizen-centric health application within schemes, entitlement, health facilities, etc. Again, a lot of technology to be used for this. For the point under improving healthcare infrastructure, the proposed interventions are that there should be a national health infrastructure development fund between 5,000 to 10,000 crores to boost the private health sector, especially in the Tier 2 and Tier 3 cities, both for private primary care and Ayushman Bharat hospitals, regional super specialty hospitals and trauma hospitals, and also look at realistic private-public partnership guidelines, realistic models which are sustainable, accountable, and which are safeguarded. So this ensures that there would be investment from the private sector to provide better facilities for our citizens along with the government, but ensure that they are viable. The last point on digital health innovation, digital health and innovation to widen access to healthcare. The proposed interventions that we recommend are to set up a national digital health authority, and I'm glad to say that this has already been set up in line with the WHO Digital Strategy 2020 to 24. And I must say that our National Health Digital Mission is probably more advanced than many in the developed world. And I think we should give credit to the government for this. The plans are in place, it has been rolled out. We now have to ensure that it is implemented and the benefits reach out to the poorest of the poor. We also propose 25 model digital health cities and districts, like the Smart City Mission, creating digital health cities and districts where there will be digital integrated systems and connectivity. This will bridge healthcare gaps. And the third intervention that we propose under digital health is that we, as a start, we look at about 1,000 virtual and remote healthcare units where they have special packages for setting up teleconsultation, telemedicine, things like EICU, artificial intelligence, based health screening, health, etc. And we give a timeline of about 2 years for this to happen. So I think in brief, these are the points that we have for a healthy vision for a healthy India. And I must say that many of these things the government has already started work on. We hope that it will continue at a fast pace, and ultimately it will result in universal healthcare and ensure quality, affordable, accessible care to every one of our citizens. Thank you very much.